A study's found that people who've had COVID are at greater risk of developing blood clots after they've been infected. To get some more details on this, Anila Dami joins me in the studio. So, Anila, what have the researchers found?
Well, researchers compared the risks of blood clots in people who had COVID and those who hadn't. They found that those who had been infected with COVID were at greater risk of developing blood clots for up to 6 months afterwards. Now, the experts at Umeå University of Sweden broke it down into 3 areas. After a COVID infection, they found an increased risk of blood clots in the leg or deep vein thrombosis for up to 3 months, clots in the lungs or pulmonary embolism for up to 6 months, and internal bleeding such as a stroke for up to 2 months. In terms of numbers, they found 4 in every 10,000 COVID patients went on to develop deep vein thrombosis, compared with 1 in every 10,000 people who hadn't had COVID. And about 17 in 10,000 COVID patients had a blood clot in the lung, compared with less than 1 in 10,000 who had not had the virus. So in context, a small number of people who are at risk, but the risk is still there. And the risk was highest during the first wave of the pandemic than at later waves.
So interesting, but how does it help in the future?
Well, researchers of the study say their findings strengthen the importance of vaccines and also help with future treatments.
This is not only for those who have high risk individuals, but also healthy younger individuals. Moreover, it's important for the healthcare providers to identify individuals with COVID-19 who are at a high risk for blood clots, so that specific preventive measures such as blood thinners are started.
It's also important, Simon, because COVID rates in England are at the highest they've ever been. And across the UK, the number of people with COVID in hospital is at the highest it's been for over a year.
Anila, thanks very much indeed. Thanks.